Step 1. Use agent and patient nouns to create 3 or 4 different scenarios around the target verb. This step allows the patient to practice retrieval of words to create the differing scenarios.
First, we're going to look at the verb drive. We're going to think of people who drive and what they drive. These cards say who and what. Can you think of a person who drives something?
A chauffeur?
Good job.
If the patient is unable to independently produce a response, you may first provide them with a minimal semantic cue. And then if they are still unable to produce a response, you should provide them with a maximal cue that can be modified to increase or decrease the level of difficulty. Semantic cues may be occupational, avocational, familial, sports, or location related. If you need to help the patient read for the maximal cue options, read the options for them. Slowly fade out the reading assistance as the patient improves. An example of a minimal occupational cue and a maximal cue follows. We will assume our patient is able to read well enough to perform the task. It is also important to note that using pictures to elicit responses is not recommended.
Can you think of a person who drives something?
No.
Can you think of someone who drives a long car for their job?
No.
Read each card and tell me which one is appropriate for drive.
Teacher, chauffeur, dentist, veterinarian. Chauffeur.
Good job. A chauffeur drives for their job. What does a chauffeur drive?
A limousine?
Great.
Step 2. Have the patient read the triads aloud. Step 2 encourages consolidation of each scenario through oral reading of each triad. It also allows the patient to practice basic word order.
Let's read each one aloud.
Chauffeur, drive, limousine. Dad, drive, boat. Paramedic, drive, ambulance. Taxi driver, drive, taxi.
Excellent.
Step 3. Have the patient answer where, when, and why questions about a chosen scenario from Step 1. This step aims to strengthen the patient's semantic system around the chosen scenario and target verb. Look for plausible and specific answers from the patient. Grammatical correctness is not necessarily required. If the patient has difficulty comprehending the WH questions, clarify the meaning of each. Cue the patient as needed to elicit an acceptable response. Once the patient has given their responses, have them read their responses aloud. Give reading cues as needed.
Let's choose a scenario to talk about in more detail. Which scenario would you like to talk about? Chauffeur drive limousine, dad drive boat, paramedic drive ambulance, or taxi driver drive taxi?
Dad, drive boat.
Okay. Where does dad drive the boat?
I don't know.
Does dad drive the boat in the bay or at the park?
In the bay behind our house.
All right. Why does dad drive the boat in the bay behind your house?
To relax with our family.
Okay. When does dad drive the boat in the bay behind your house to relax with family?
Every Saturday.
Okay, now let's read what you wrote.
Dad, drive boat in the bay behind our house to relax with family every Saturday.
Good job.
Step 4. Have the patient decide whether or not a set of 12 sentences are semantically correct. The clinician will give the client 12 different sentences, 3 sentences from 4 categories. The four categories are A, correct, B, inappropriate agent, C, inappropriate patient, and D, thematic reversal, where the agent and patient are switched. The participants are asked to think about what makes sense given what they know to usually be true. Only a yes or no response is required. To increase the difficulty of the task, have the patient explain which word in the incorrect sentence was inappropriate and why. One sentence from each category will now be modeled.
So now I'm going to read some sentences to you, and I want you to tell me yes if the sentence makes sense and no if it doesn't. The first one, the farmer drives the tractor. Yes. Great. Next, the teacher drives a tank.
No.
Good job. That doesn't make sense because a teacher could drive a tank, but they probably wouldn't. Next, the chauffeur drives a tricycle.
No.
Excellent. A chauffeur wouldn't drive a tricycle, but they might drive a limousine. Last one. The van drives the mom.
No.
Great. A van wouldn't drive the mom would drive the van.
Step 5. Ask the patient what verb they have been working on. This step allows the patient an opportunity to independently retrieve the target verb. Step 6. Repeat step 1 with no materials on the table and without providing additional cues. Prompt the patient verbally as was done in step 1.